So, Doctor, the purpose of my visit today is to convince you that when it's time to add on an IL-5 antagonist for patients with severe asthma, start with Nucala. But before moving forward, I just want to talk a little bit about the role of eosinophils because there are two sides to it. Eosinophils do play a role in maintaining health. They help regulate the immune system and also provide host protection. But it's the presence of too many airway tissue eosinophils that can be associated with a greater likelihood of exacerbations and increased symptoms. And about 50% of patients with severe asthma have these persistent eosinophils. So doesn't it make sense to use a therapy that targets the reduction of eosinophils without complete depletion? That's precisely what Nucala offers your patients. Only Nucala has been evaluated and demonstrated lasting eosinophil reduction for 4.5 years. In a 4.5-year open label trial, patients on Nucala saw about an 80% reduction in eosinophil blood levels that were maintained throughout the duration of that study. And this occurs rapidly, as was seen in a separate phase 2 trial where there was a 74% reduction in eosinophils occurring within the first 48 hours. Now, the clinical significance of this data is unknown, but let's just take a quick recap of the criteria for the Nucala patient, and that includes patients 12 and older. And these patients also are on 2 or more controller medications, including high-dose ICS, and they've experienced 2 or more exacerbations in the previous 12 months, and they may or may not be on daily oral steroids. Once that patient's been identified, run that CBC with differential. The reason that's important is because patients with blood level counts of 150 or greater, that's the biomarker that's a predictor of efficacy for Nucala, which no other IL-5 antagonist has. Now, the major motivating factor for healthcare practitioners when it comes to the efficacy of Nucala is reduction in exacerbations. And Nucala offers patients powerful protection from exacerbations, as was seen in the Mensa trial. This was a 32-week trial where the primary endpoint was the frequency of exacerbations. And remember, this was on top of the standard of care. At the end of that trial, patients in the Nucala arm saw a 53% reduction in the rate of exacerbations versus patients in the placebo arm plus standard of care. And furthermore, exacerbations that required a hospitalization or an ED visit, there was a 61% reduction in the rate of exacerbations for patients randomized to Nucala versus placebo. And the exacerbation rates that were observed were lasting, as was seen in the Columba trial. Now, this was a 4.5-year open label trial where the primary endpoint was long-term safety. But in a post hoc analysis of this study, you can see exacerbation rates that were observed were maintained and lasting. No waning effect for patients on Nucala. Now, this was a post hoc analysis, so the results are descriptive. Furthermore, Nucala, there is a trend with Nucala of greater exacerbation rates with higher eosinophil levels, as was seen in a post hoc analysis of the Mensa study. But again, remember, post hoc analysis, these results are descriptive. And reduction from exacerbations is only part of the efficacy story. Nucala also demonstrated improved lung function. Now, numerical improvements were observed in 3 other clinical trials for Nucala, but these improvements the outcomes were inconsistent. However, in a secondary endpoint of the MUSCA study, which was a 24-week trial with a primary endpoint of improvement in quality of life, you can see that patients on Nucala saw observed better breathing after the first dose. Now, these 4-week results are descriptive only, but at the end of that 24-week trial, patients on Nucala saw a 120 ml improvement in lung function versus the placebo arm. And Nucala is well tolerated. In the 3 clinical trials, the most commonly reported adverse events were headache, injection site reaction, and back pain. Furthermore, these results were similar as was observed in the 4.5-week Columba trial. So We've talked about protection from exacerbations, lung function improvement, and a medication that's well tolerated by your patients. Based on that information, are you convinced that when it's time to add on an IL-5 antagonist for your patients with severe asthma and an eosinophilic phenotype, will you start with Nucala? Good Lord.